And here we go. Hello, Blue Hope Nation. This is Heather, one of your community managers, and I am here with Danielle Peterson. Hi, Danielle.
Hey Heather, how are you?
I'm good. Well, I'm frustrated because we couldn't get our Facebook Live to stream. I posted in Blue Hope Nation, but it's almost as if the entire nation is working from home and using the internet at the same time. So
Weird.
I don't know what's happening. So I'm really sorry that we couldn't go live. We wanted to make this very interactive, but we are going to record this and then we will upload it into Blue Hope Nation. And if you have any questions after you watch this, please drop your questions in the comments below. And Danielle or myself will reach out to you. As always, you can message us on Facebook and reach out to any of your navigators and also call our helpline. So we hope this is informative to you. Today we are talking about mental health and social isolation. We are in unprecedented times, uncharted territories with this coronavirus. Everyone has been sequestered to their home, and it's kind of just, it's scary and unknown. And so Danielle, who is our clinical social worker here on staff, is here with me today. And we have some tips to give you on how to maintain that balance and that mental health during this time of social isolation. So Danielle, I kind of want to talk about the elephant in the room, in that those who have cancer or those who have family members with cancer, they kind of live through this all the time, right?
Yeah, Heather, you're exactly right. And I know for myself and the rest of the team here at the Alliance, we've been thinking a lot about that.
Mm-hmm.
Do you feel like our community may have some advice to give the rest of the world and each other about this? Because people with cancer face extraordinary uncertainty because of their diagnosis. Yeah, they ask some pretty big questions like, what will happen to my kids, or what will I do about my job, or how will I make ends meet? Some even ask questions like, will I live to see my son graduate, right? These are big questions. This is what uncertainty feels like, and this is what it's like when you get diagnosed with cancer, as we know. So what we're seeing is that people in the larger community are also starting to ask questions like this. We also know that people with cancer deal with social isolation, right? So they deal with this uncertainty, but they also have to deal with social isolation. One reason could be because they can't go to work like they usually do, right? And for many of us, work is like one of our primary ways of getting that human connection and getting that interaction. And some, of course, are restricted because they're immunocompromised and they need to restrict, their physical contact with other people so that they don't get sick. So I will just say, Heather, that over the years as an oncology social worker, I've seen people with cancer take on uncertainties, and new normals and changes to just about every aspect of life, time and again. And because we know people do this, I have a sense of hope that, we as a community can face this really unsettling time.
Yeah, it is unsettling. And I agree. I think that, we can absolutely look to our allies now to say, how do we get through this? What have you done, or what have you seen work that helps you get through this time of isolation, this time of, it's kind of scary. And doctor's appointments are being canceled. People can't find products that they need, even just things like hand sanitizer and toilet paper, which to our audience is also a big deal. Like, there's so many things that we need to talk about and give each other hope and support. And that's really what we're trying to do today. Full disclosure, we are not medical experts. We want to give you tips that we've seen work over the years as far as maintaining that balance, both mentally and physically. But if you do have medical questions, please reach out to your primary care physician, call our helpline, go to our website. We do have a landing page about COVID-19 that I will drop in the comments below when we're done, so that you can see what the CDC recommends and that what we are doing for our live events. You know, they are suggesting that no one get together over groups of 10 or more. So that, you know, we had to kind of pivot on things like our DC Scope It Out and our St. Louis ND. So more on that soon. But Danielle, maybe before we jump into the tips of how to maintain that balance every day, do you want to speak about just in general anxiety and isolation and how those two kind of go together?
Oh yeah, absolutely. Um, so when we are anxious, anxiety it's very powerful. We know how powerful it can be. Many of us have faced anxiety because of cancer related things or just because we're human. One of the things that anxiety does is cause us to be very hypervigilant. And it's a way that we deal with trauma and what is happening is our brain is trying to keep us safe. So it tells us to stay on guard and to be really anxious about potential future threats. The problem is our brain isn't always good at knowing when we should be alarmed and when we shouldn't. So it just tends to become hyper vigilant and over focused and sometimes even obsessive about potential fears. So we're really not sure what level of fear we should be at, right? We have people even disagreeing about that right now in our country. So I imagine that being told to stay in your house and being told, you know, that we're not quite sure what this is going to look like is causing a lot of anxiety for people who've dealt with anxiety in the past or really don't find themselves to be a very anxious person in general. But also, Heather, I think one really difficult thing is when you talk to a mental health professional and you ask them, you know, what's the best thing to do for anxiety or depression? They're going to tell you to connect with people. You know, tell you to make sure that you're connecting with friends and family and staying social. In fact, having less of a desire to connect socially is usually one of those first signs that we might be feeling depressed or anxious. It's really challenging for us in general because staying social is actually a great way for us to cope with challenging things and with stressful things. So when we're being told not to connect, not to stay, you know, not to be out in physical presence with other people, I think that we need to think about, I love the word pivot that you just used. We need to pivot and think about how to do this differently. A lot of people are remembering, you know, are saying, I've seen this in social media, that it's just physical presence, but we can still stay engaged and we can still stay connected to each other. And that's really the key about our conversation today and just in general is how do we still maintain social connection, even though we may need to be doing that within the boundaries of physical isolation.
Right. And we're going to talk about that and give you some tips on how you can connect even when we can't physically be in the same room, which I'm excited about because there are lots of ways. And I think too, Danielle, the many things are out of our control. So looking at what can we control right now, right here, and staying in that present moment is going to help us get through this. I know for myself, I can't think about 8 weeks out. I have to just, okay, I'm going to get through this week and then we'll figure it out as we go along. So I think really staying in the moment is going to be key.
Yeah, Heather, that's a really good point. And I think that's what makes this time especially difficult because you're going to hear us talk about today and other people telling you to stay in the present moment, just like you talked about. Those are going to be certainly our tips. And at the same time, this crisis we really do need to get prepared in some way or another and in many aspects of like basic needs, right? So I think that even though this isn't the topic of our conversation today, I do want to mention that like an ounce of prevention is worth a pound of cure, right? That old adage really works adage. I don't know how to say that.
Yeah.
Really does fit here. So, you know, I just want to quickly give a few tips about, you know, what things can you maybe prepare for future because we don't necessarily know how long we might be sequestered or on quarantine. So some tips that I would really suggest for these sorts of things is communication. Do talk early and often to caregivers, your medical team, friends, family, about your concerns about how this social isolation will impact you instead of waiting for that crisis to happen. You know, think about things like food and other basic needs, not only for yourself, but for pets. I'm thinking about medications. We know that many doctors are could potentially be willing to write scripts at a higher quantity to reduce the frequency of having to go in to get those medications refilled. Many doctors are looking into telehealth options so that you can get care through the phone or through some sort of video conferencing. So do call your doctors now and see what sort of structure they're putting into place to reduce any serious crisis down the road. Um, I think that it doesn't hurt to call people that might be like bill collectors, because some of us are facing serious income changes because of employment loss due to this virus. Um, and so, you know, I think it's okay to make some calls to people and just say, are you putting any sort of plan into place to help people who might be impacted during this really unique time?
Yep.
And they may not, but they may, you know, they may. So call and ask, do it now before you don't have the money to pay for that bill that, you know is going to come in the next month or so.
Right.
If you have lost your job because of this virus, please do look into unemployment. Our patient navigators can help you find the resources that you need. Talk to your HR people if they exist. Again, it's just that idea of staying in contact more than maybe what feels normal or typical for you. The takeaway really is, yes, we need to focus on staying in the moment, because if we don't, we really are going to feel completely overwhelmed and anxious. But there are some things that we need to do to plan and prepare. And if we do that, it might give us a sense of peace and comfort that we wouldn't have had otherwise. I also suggest talk to your friends and family about what they're doing from each other. We're all learning about this together, and someone might have a really good idea that you haven't thought of, you know, to really help you get prepared for the next several weeks, potentially longer.
Yeah, and I think those are such great tips and ideas, and that will help mitigate the anxiety if we have some of those things put in place. And those are the things we can control. Those are the things we can, as you said, be preventative about. So again, we will drop the link to our webpage that has more on the COVID-19 and some stats from the CDC. So why don't we jump into those fun things? And I call them fun, but sometimes, you know, it's easier said than done. Those things that we can do to maintain that mental health and that balance in this time of uncertainty. Social connection. We've talked a lot about that. So do you want to start there about some ideas of how people can socially connect without being in the same room?
Yes, absolutely. And again, it goes back to what we were talking about earlier, that even though it's not maybe within physical contact that we're connecting with people, that we still can certainly engage and continue our relationships. And thank goodness we live in a time when technology can really be an asset to us, right? So this might be that nudge for those of us who feel less comfortable with technology to learn things like FaceTime or Skype or other forms of social connection. There are many social communities out there that already exist. One, of course, is our Alliance Daily Chat. For those of you who don't know, we meet every weekday from 12 to 1 Eastern Time to just talk about what it's like to face colorectal cancer. Because of this virus, we are ready and willing to have conversations about this with you. We expect there to be an increase of people coming to our daily chats, and we want you to come along to talk about how you're feeling about this. We are allies. We are in this together. Cancer or not, virus or not, we are doing this together, and we really hope that you join us in chats. I moderate a caregiver chat every Thursday, so I'm looking forward to connecting with my caregivers and our caregivers that come and join us on Thursdays from 1 to 2 Eastern Time. Again, if you're a caregiver and you just have general questions or thoughts about caregiving because of cancer, or you're really worried about this virus and how it's going to impact your loved one, come and join us tomorrow. We'd love to have you, and every Thursday going forward. So again, social media technology, it's a great tool. But it can also feel a little overwhelming. So Heather, I know that this has been something that's been important to you, that you've kind of been working on yourself. Talk to us a little bit about keeping balance. We've been using that word balance a lot.
Yeah, I mean, it's, I swear off social media at least once or twice a day, and yet that's what I do for my profession. So I really can't. But I think it is hard because there is so much negativity swirling out there. And with every negative post, there are some positives. So I would just say, set aside some time, maybe a couple times a day, to check social media, but don't get trapped in that inertia of, oh my gosh, what about this and what about that? And I think we can go down these big rabbit holes of what could happen. And again, some of this is out of our control. So I would check in with your family. I would make sure that your loved ones far away are doing okay. Let them know you're okay. Maybe giggle at a few videos and memes. I will say I am impressed at the outpouring of love and support I've seen online. There really has been, restaurants are opening up to those who might be affected and can't get a meal. But this hurts our small businesses. This hurts our nail technicians, our barber shops. Reach out, see what you can do to help someone else. But also, I think put the screen down and, this has never happened before. This opportunity where we actually can slow down and be present with those in our life that we live with. So, I would just say, put the phone down, play that card game of Uno or Monopoly, and, just enjoy the people that are with you right now. I mean, I don't know the last time that my whole family was home every day, all day for more than 3 days at a time, so it is unique. So I would say don't get too wrapped up in the social because there is some negativity out there, but, schedule your time and then put it down.
You make some really good points in there. And one thing that I'd like to just say is that we have more control over what we see through our social media than sometimes we remember. So we were talking about focusing on what we can control and what we can't. This is not social media is not a black and white dichotomous issue, because you're exactly right. Social media is how we're going to stay connected with each other. It's going to be a place where we find laughter. It's going to be a place where we see kindness and generosity. And we certainly don't want to limit our taking in of any of that. And yet we want to be careful about those posts, even potentially people that are not going to help us in that arena and maybe will only encourage our anxious thoughts. So that's where we can make some decisions to have a good filter here and take some breaks from posts, from people that may not be giving us what we need in this time of a heightened alert. Your brain isn't going to need any help being anxious. You're not going to miss out on anything when it comes to people that are not providing a lot of encouragement or support during this time. So I think that you make some really good points there, Heather, of taking advantage of what this is offering us, and also take control of your social media and choose what is going to be helpful. And it's okay to release those things that aren't going to be helpful right now.
Right. And I think we are intuitive enough to know when something doesn't feel right. I mean, I know that I'll start reading articles and I'm like, okay, I just realized that I went from here to here on my anxiety level. Also you talk about that heightened awareness, know yourself, know when it's getting you anxious, and take a step back, maybe revisit it in a few hours, but just be conscious of that as well. And then there's some things to do that don't have to do with social media, like writing a letter. Do you want to talk about that?
Yes, let's not forget about other ways we can connect with each other. This kind of gets me excited, but you could write some letters to some people that could use a card of encouragement during this time. or emails. I know, at least for me, I'm not even sure what is going to happen down the road with touching mail and things like that. I mean, I know that we're all kind of just on hyper alert around that, but even if it's not physical letters that you write, which by the way, you could write them now and send them later, you could do emails. And I encourage you to maybe send an email every day. Pick one person to just send an email to and say, hey, I'm thinking about you. This is kind of crazy, isn't it? You know, how are you doing? Just want to let you know I'm thinking of you. I also think there's some really fun greeting cards companies that allow you to send cards for free. So that could be something that you could look into as just a way to encourage your family, your friends, and also stay connected. Another thing I wanted to mention is that, again, just as a community, we know that people's level of anxiety is quite high and might even continue to be raised. So in all seriousness, we at the Alliance do want to remind you that our helpline is available to you Monday through Friday, 9 to 5 Eastern Time. Toll-free number 877-422-2030. I know that we will put this in the comments for you, and you can find that number on our website. If you feel like you're really struggling, and it's okay if you are, and it's outside of those helpline numbers, we're also going to include a couple hotlines actually that are open 24/7, 365 days a year. That is the Substance Abuse and Mental Health Services Administration and the National Suicide Prevention Helpline. As a mental health professional myself, both of these organizations know that people will be reaching out to these numbers at a higher level than usual because this anxiety is real. So it's important that we know that we have a place to turn no matter what time of the day and when that comes up for us.
Perfect. Yeah. And Danielle, just to reiterate what we have already talked about, I'm going to drop the link to the chats in the comments. I'll also drop our hotline. And then, as you said, I'll drop the SAMHSA and National Suicide Prevention numbers, because I think that's great. I mean, our hotline is 9 to 5. So, but if, you know, at 2 a.m. you need someone and there's no shame in that, please pick up the phone and make that phone call. Really helpful.
Let me also just make a note here too about counseling and therapists. What I've been hearing from that community is a real dedication to their clients.
Great.
Mental health professionals across the country are very aware of what's going on, and they are committed to continuing to provide services. So kind of going back to earlier what we were talking about, please, if you are currently in therapy or in counseling, reach now about what, you know, it might look like a couple weeks from now, a couple months from now, so that you can continue your treatment, because they will find ways to stay connected with you. In fact, the federal government is actually putting policies in place to help protect mental health professionals who are finding new ways to stay connected. So there's no reason why you shouldn't be able to continue your mental health treatment if you're currently getting treated for any sort of mental health condition. It's not the time to stop counseling. It's not the time to stop a psychotropic medication without professional guidance. So I just want to encourage people to not assume that they're not going to be able to get the treatment that they need. And if you feel like, you know, this is really the straw that broke the camel's back, I've been trying to get through, and I've been hanging on, but now with this virus, I'm really worried about how I'm doing. This is a great time to reach out for mental health care. It's available to you. If you don't know where to start, please call our helpline. Our patient navigators will show you and give you some tips and suggestions on how to get access.
Perfect. That's great. All right. Exercise. Some people might love that and some people might hate it. What are some different exercises we can do?
Yeah. So again, I'll tell you, as someone who loves Zumba, like all my friends and family know that my gyms are closed, right? So like, I'm concerned about how I'm going to stay exercising, because exercise for me is very important to my mental health. Guys, it's great to help us with our immunity. It's great for our overall strength, and it plays such a big part of our mental health. So we really can't stop exercising during this time. It's probably one of my biggest suggestions for all of us is to try to find a way to exercise. And we might have to be creative, right? Even if just sitting in a chair and doing some arm circles and some stretching gets your joints moving, gets your body moving, no matter what ability level you're at, there is a way to do some sort of strength or flexibility training. You can find some really good workout videos through YouTube by just maybe typing in beginning yoga or beginning stretching or beginning cardio. There's so many things that you could look at online. I bet you may also have some chores to do around the house, right? Like, I'm so sad that now I might actually have to get to that one thing that I've been putting off forever because, I just don't have time. But now I have time, and I'll be doing some cleaning that I don't usually get to. And hey, that's exercise too. Vacuuming is hard. I break a sweat when I'm mopping and vacuuming.
Yeah.
Maybe every day you're picking a chore to do for half an hour. Maybe it's a chore that makes you stay on your feet longer than what you would normally do, or be walking from one end to a room or one end to a house and the other. And then, of course, and we're going to talk about this maybe at multiple places in our conversation, but a lot of recommendations have been to get out in nature.
Yeah.
So we can social distance outside, right? Like,
Yeah.
I took a walk with my husband last night, and every time I passed him on the sidewalk, I was like, kind of as a joke, but at the same time, I think we're all really cautious. We know to keep our distance outside, but we want that fresh air. We want the sunshine. We want nature to remind us about our place of where we fit in the wider world around us. And so if at all possible, go outside and get some exercise that way by taking a walk or, a jog.
Yeah, it's funny. Like, I am so excited to organize all my closets because I don't have time, and that's like, I enjoy that. So it's funny to see what people want to do and don't want to do. I've also noticed a lot of companies are giving free subscriptions, which I think is awesome. So like Peloton, I believe, is like, they either reduce their fee or they're giving some yoga and cycling and treadmill courses. Beachbody.com has resources. YouTube is a great place to start. That's free. But I agree, like, get outside as long as you're not touching like playground equipment and like fences, like make sure you're not touching surfaces. But, I had thought we have all these trails around our house. We're right outside of DC, and there's things that I haven't gotten to because we're always so busy. And so I want to just make a list of like all the trails that I want to visit. And now there's not a whole lot of traffic either. So like there's a lot of barriers are lifted also. So yes, get outside, walk. You can turn it into an activity. Now, most of us, our kids are home if we have kids. So, do a nature hike and talk about what they see, what they hear. There's lots of great ideas out there. I'm just so impressed with the online community reaching out and like giving resources to everyone because we are all in this together. So, and if you need a place to start or are not sure, please reach out to us. Private message us on Facebook, call the helpline. We are happy to help you do that research and point you in the right direction. So let's talk about our new schedule because we're all on a new schedule now. Where does someone even start? They can't go to work. They can't hang out with their friends.
Yeah. This is actually a conversation that comes up for me regularly with people who are just diagnosed with cancer, who are just, beside themselves about what they're going to do because what they typically would do is no longer available to them. There is a lot of loss that happens when we can't stick to the same schedule that we've been used to. What we know is that when people do stick with the schedule, when they feel productive, when they feel like they're staying focused on things that they can control, they end up feeling better. So one suggestion that I would make is to come up with a quarantine schedule. a daily schedule for you, your kids, you know, whomever you might live in the house with you or not, if you caregive from, you know, a distance, come up with a new schedule that takes into account some of the main things that are being suggested to us to keep ourselves well, but really just so that every hour you kind of have a direction to go in so that you're not left sitting on the couch and worrying and being fearful and focusing on the things that you can't do right now. So really a schedule helps us to, in some ways it's a bit of a distraction. It also helps us feel in control. It helps us feel productive. And as human beings, those things are really important to our mental health.
Mm-hmm.
So some of those things that we want to make sure are included on our new schedules during this time will be adequate sleep. Our immune system needs us to be getting a proper night's sleep. We know when you go through cancer treatment and when you're stressed out that there can be some big issues with this. So please, if you're finding that you're having trouble sticking to a good sleep schedule, either you're sleeping too much or not enough, please reach out to us on the helpline or, you know, your medical provider. Also focus on proper nutrition. This is a great time to be making sure that our meals are healthy, that we're not overeating because of stress or under eating because of stress. We want to make sure we're drinking a lot of water. Of course, we've always heard those things about trying to, you know, when we want to stay healthy. So make sure that we're doing that. And maybe we have more time to meal prep or more time to dig into a recipe that takes more time to prepare. So it could give us an opportunity to maybe try some of those recipes that we haven't because we're just running from one place to the next. We talked earlier about exercise. Make sure on your schedule every day you've carved out about 30 minutes, maybe more, to do some sort of exercise or some sort of chore. Maybe that includes time out in nature or not. Try to include going outside or looking out a window if your climate doesn't allow you to be outside. You know, so make sure that getting in touch with nature is part of your schedule. I've seen some blog posts that have said this is a great time to stop bad habits like smoking, for example. And I thought that was really interesting because I would guess that if I were a smoker, I'd think, yeah, right, this is the last moment that I think about quitting smoking, right? Like, I totally get that. Like, that makes a lot of sense. And yet, smoking or others, you know, other forms of like substances, there might be more of a temptation to pick those up right now because we're stressed and we're anxious, and we want to be cautious not to do that. There are some great resources out there on help with these sorts of like substance use issues, including smoking. So if you feel like this is the time that you want to tackle this, we want to empower you to do that, and we've got resources for that we can share. Also, when it comes to our immune systems, you'll hear a lot of people talk about the importance of reducing stress. That's kind of hard to do in this with what's going on, but we can think about including things on our schedule that are enjoyable to us, that are relaxing. I would really encourage you to either start your day or end your day with a gratitude journal. Just a way to focus on the things that you're grateful for with cancer or not, with this virus going on or not. And it's hard at first, but then when we train ourselves to be on the lookout for these things, they'll come more easily, and it's really helpful. So we kind of have to take control a bit here in this area to bring that balance back. Again, we're not going to have to try very hard right now to feel stressed out or anxious. We will have to try hard to put some balance in, some perspective, and some gratitude.
Yeah, I love the gratitude journal idea. I think too, I don't know that we've mentioned meditation. I mean, even just 5 minutes, either at the beginning of your day or at the end. I know that's hard, but just I've heard, you know, just starting really small, like 2 minutes, and then 4 minutes, and then 5 minutes. But again, it's a chance to ground us and kind of refocus.
Yeah, I'd love to put a plug in right now, Heather, for Mental Health Mondays.
Yeah.
Or Fridays. So after you watch this video, you can go on the left side of the page and search #MentalHealthMonday. And you're going to find a bunch of tips and blogs and articles that we've been posting every Monday about mental health. And you're going to find some great meditations, guided imagery sessions, and other suggestions on how to maintain mental health in general. So I think it'd be a great idea for you. Oftentimes those mental health Mondays get missed because, you know, they kind of go along with the feed. So if you're not on Blue Hope Nation the second we post that, you may have missed many of them. So go back again, you just search hashtag Mental Health Monday. You'll find a bunch of them, and I encourage you to take a look at them and maybe try a new practice, try a new meditation or a guided imagery. If you're looking for something more specific, reach out to our navigators because we have some good ideas.
Yes, love that. And also, we always are looking for more content. So if you have a tip that you would like to share with us about mental health or caregiving, we're always looking for caregivers to give us their, 1 to 2 sentences of what worked for you. Please drop them in the comments or message us on Facebook, and we will put it out there and share with our community. So thank you, Danielle, for bringing that up. Let's see. We are, so kind of wrapping it up soon, but how do we stay positive? Like how do we look for those silver lining in all of this? Because there are some, and we've kind of alluded to some of them, but talk about just staying positive and looking for those opportunities.
I think we have to just be open to the idea that there could be some silver linings.
Mm-hmm.
It really starts with just making it a possibility that we might have some things that happen that are lovely and bright and encouraging that may not have happened without this. That's a stretch to say. I get it. It's hard to even say those words, but guess what? How many times have we heard our allies say the very same thing? Like, I would never wish cancer on anyone. I'd give anything to not have to go through this. But because I did, XYZ happened. And that is a great example of what it means to just be aware that silver linings may happen. It's really the key to focusing on what we can control and without, focusing really on what we can't control.
Mm-hmm.
We have generated a list, Heather, right, of some fun ideas, and I would love if in the comments you guys add to this things that we could do, again, things that we could focus on that might produce some silver linings. So I'll throw a couple out now. Puzzle. I started a puzzle yesterday to take over the time that I would usually have of like commuting to these places that I go after work, because I love puzzles. I never get a chance to do them, and I have it in a place where if I'm feeling restless or anxious, I can just go up and try to find a couple pieces. I don't know, there's something about putting a puzzle piece in its place that really is calming for me. You could read a book, right? Like, I know that's simple, but sometimes when we feel anxious, our brains really don't know what to do. Like, if we feel stuck, that's totally part of feeling unsettled and anxious, and that's normal. So I know these things kind of sound silly when we talk about them out loud now, but for many of us, we don't know what to do because we're feeling really stressed out. So that's okay. Any simple examples or ideas, that's what we want to kind of spur on people's creativity on how to just stay active during this time. One of the things I plan to do is organize photographs. So I've actually had to cancel several family gatherings. Unfortunately, this virus has really lined up with a lot of family gatherings that I had planned. I'm really, really bummed about that. What I've decided to do in the place of that is organize my family photos. It's been something that I've wanted to do for a really long time, just never have time to do that. But I like the idea of looking at them and being reminded of my family and go back into time into some really great memories that I've made with my family. You can have a new hobby. I've even heard of people suggesting teaching a pet a new trick. I think that's hilarious. That's a great idea. Share your videos, please, if you're trying to teach your, dog how to roll over or something like that. There's a lot of focus on generosity, like you mentioned, Heather, and like just leaving this historical time with a sense of humanity and a sense of just generosity. You could go through your closet, right, and come up with a pile of clothes that you plan to donate once you're able to do that. Yeah, so those were some ideas. What else? What do you have?
So I am journaling every day because I do think this is also a historical time in our lives. And the fact that, I'm homeschooling all of a sudden and
Yeah.
working from home, and just, yeah, kind of the community outpouring that I've watched, is remarkable. And so I'm trying to journal every morning. I'm actually trying this 5 a.m. club. So I get up at 5, and it's learn something, write something, do something, and I'm paraphrasing, but you take 20 minutes to do something so active, go on a walk or on the treadmill, 20 minutes of writing, so journaling, and then 20 minutes of learning. I usually get the Washington Post on the weekends, but I changed it to every day now since I'm home. So I try and read the paper, or The Economist, something to just keep me up to date. So I'm doing that. And then I bought a bread maker. Like, I do not like to cook. I am all about like ordering in and making it easy. But I bought a bread maker and a pasta maker. And so the kids and I are going to just try to make bread and pasta and do things that we wouldn't normally do. I dropped a couple of bottles of wine off to neighbors that are older, and wrote just a card with my name and my number. And we have a lot of people that don't have family around here. So, I just want people to know that we are all in this together, and that it's strange times, but we must continue on, and we still have to go to work, and we still have to take care of our families. But we do have these little windows of time, and there's some fun things to do. I love the idea of puzzles, and reading. We're big readers, so we have a big basket of books now in the middle of our living room. So if I need quiet or they need quiet, it's like, okay, grab a book and let's just sit and read for a little bit. But we'd love to hear what you all are doing and have done in the past, like what has been successful for you, as far as hobbies. I think it would be fun to like learn guitar or Spanish or something, but that's like really optimistic. I think I need to not ready to go there yet.
Sure.
um,
And we hope that the suggestions that we've shared today would be fitting to you if you're currently doing treatment for colorectal cancer. Like, we tried really hard to come up with suggestions that is really, if you are only in your house and not able to leave because you're immunocompromised. We know so many in our community are. We know so many in our community are not feeling well physically, that are already dealing with a lot of loss because of cancer. So we don't take that lightly. We know that everybody's ability to access, resources are different. Their consequences of this virus are different. So we were hoping that today we could give you some ideas that would be applicable to people who may just be asking this question because they were diagnosed with cancer and they have to social isolate. But we hope that in the comments, that you continue to share your creative ideas, because again, we really feel like this isn't new for you guys, for many of you anyway, that this is something that you've had to tackle, that you've had to face. Many of you have had to become really creative, and it hasn't been easy, and we know that. But we'd love to learn from you if you've got ideas for us and any suggestions that might be helpful to other people who are just now starting to understand what it means to have to distance physically from people and from their community.
right. And I think those are all such good points, Danielle. And just a reminder too that, virus or no virus, we are a nation of allies. We are here for you. Keep coming to Blue Hope Nation, asking your questions, reaching out, join the chat groups daily. We have a buddy program. I don't know if you want to talk about that quickly, about either becoming a buddy or getting a buddy.
Absolutely. We are really prepared to enhance our services during this really unprecedented time. So please don't assume that our supportive services aren't going to keep going on, because they are, and they're stronger than ever. And our program is a great example of that. Our buddy coordinator, Marielle, is very much aware that we might get more requests for our buddy program. We're ready. You know, we are ready to connect you with other people who have faced colorectal cancer, who've been around the block a couple times with it already, and who may also want to provide some extra support during this time of anxiety and just general, you know, uncertainty. So yes, and I think that at the bottom of the or, you know, below this video, we can make sure that you have the best link to use to learn more about our buddy program, our chats, our helpline.
Mm-hmm. And Danielle, you have in our notes something that, you know, people may find hard to do, but laughter, you know, like just, can you talk to us about that? Like, why is that so important?
Well, it just feels good.
Mm-hmm.
Some things right now that feel good. There's so many things that are not feeling good. Again, I know that I'm kind of sounding like a broken record, but we don't have to work very hard to be worried. We do have to work harder right now to laugh. One of the reasons is because we may not be brushing up other people that where we might have that natural smile when we're opening up a door for someone, right? Or being able to wave someone in, you know, when we're driving. Like there's a lot of social connection that we take for granted that involves our nonverbals and our faces. And I know that kind of sounds silly, but it will have an impact on us if we're not doing that in the same way. So I think about all of the remote workers who might feel just a little bit down because, again, we take for granted how much social connection and being in the physical presence of other people has on us. So actually reminding ourselves to laugh is a way we can keep balance. A lot of research about the powerfulness of laughter. So look for a comedy special on Netflix. I love Jim Gaffigan. He's like my favorite comedian. Look for even other YouTube videos and things like that that might be funny to you or bring you some joy. Funny babies, laughing babies, always just give us a sense of of beauty and of just joy and of hope. And I think we really need that right now.
Yeah.
Do you have any suggestions of places that you go when you need a good laugh?
Yeah, I talk to my kids. I mean, I have a 6-year-old. He can call you if you need a good laugh.
Great, that's great.
Yeah, and my friends. I have several group chats with different friend groups from around the country. And, there's always that funny one in the group. And but I agree. I think it does make you feel better, no matter what you're dealing with. So, and I don't think we should feel guilty about laughing and having fun every now and then, because we're going to have plenty of time for the seriousness and the feeling down. So I think it is important to find those ways to laugh. And there's like sitcoms, Netflix has a bunch where, and they're thoughtless too. I like them because I don't have to really be glued in, it's mindless and you can laugh and kind of giggle. So I think that's important. And so I really do hope that, the things that we've talked to you all today give you the sense that we are with you, we want to support you, and that we understand that this uncertainty and fear is not new for you if you are living with cancer, if you know someone who is, and that is not lost on us. And I just want to say now, Danielle, our allies who are dealing with cancer need us now more than ever, especially with the limited resources and the limited interaction. And so please, please, please reach out. We're on Blue Hope Nation. We're in chats. We reach out and get a buddy, call our helpline. We are here for you. We will have some announcements later today about some virtual events that'll be coming your way. And that's another way for you to get involved, help your community, give back, however you can manage or feel comfortable doing. We're going to give you lots of ideas for that. And it'll be fun. Hopefully it'll spur some laughter and you might meet someone new. So please be on the lookout for that. Danielle, anything else you want to say before we close up here?
I just want to thank you for having this time today, Heather. I think it's a great example of our commitment to people who are facing this time together. Our mission doesn't end, and it's stronger than ever right now. And we hope that you feel that through this video. Don't hesitate to reach out to me directly, to the navigators, and we'll continue to check in with you as well. And we just want to thank you for being such an honest and open and real group of people who have been doing this, connecting with each other through Blue Hope Nation for so long already. We're so grateful for you and that you trust us with your time and as your community.
100%. Couldn't have said it better. Thank you, Danielle. I so appreciate you. And we're going to do this again. We will try and go live again next week. I believe I'm going to be talking with Val about self-care. And then Marielle's going to pop on too. We're going to be talking about how to talk to your kids when you have cancer or when your spouse has cancer. So those are coming up. Hopefully the internet will catch up with us and we will be able to go live because we do really want to interact with you. So please send us your questions if you have any. And thank you so much for joining us. We will be in touch soon. Stay safe.
Bye.